Of course, understood. And we wait anxiously to see it. As you gathered and heard explicitly, many of us were disappointed to not see any funding for increased Medi-Cal provider rates. So, but the January budget proposal is a proposal. It's not the final budget. There's a May revise, and there's another opportunity to make some amendments and move some priorities around. This is a top priority. I hope you'll understand of the legislature from the hearings that you've been in and from what you've heard shared with you, again, bicameral, bipartisan. So I think many of us would really like to see some movement in the direction of increasing provider rates. We get that, it's a very large number to really get to where we need to be, but if we don't start moving there now, we're just not going to get there. And there's folks on the front line like Dr. Pan and others, providers who are seeing the devastation that it's wreaking on vulnerable communities. Final question. Does the department feel that any expansion of dental managed care would be an appropriate route to take, given the challenges that exist with beneficiaries receiving access to care through the fee-for-service program, or is that not something you're interested in?
To Dr. Wood's earlier comments and my response, I think, we're open to different models. I know that I was not obviously at the department when there were a lot of challenges brought up with the Sacramento and LA managed care model. That being said, we are successfully seeing managed care work on the Medi-Cal managed care side for medical services. I think dental is very different than other types of medical care, and so to the extent that there are proposals to either better align incentives in the dental managed care world or to do things slightly differently, I think we're always open to taking a look and considering different options. But obviously, we are but one, we're the administrating agency, but to the extent that we rely on providers to actually participate, as this hearing has been about, we would be mindful of the fact that any kind of change in either a model or a change in a kind of payment type would require providers and beneficiaries and other stakeholders to be part of the conversation, and generally we really like to have some greater consensus before we make significant changes like that. So it's not to say that we're not unwilling to have a conversation, but it's not a conversation that would just include us. It would have to include a lot of other individuals.
And if I could just add to that, I think one of the things you'll see again in our waiver proposal is the concept that, as Jennifer said, we need to make sure that we're aligning the incentives. And one of the challenges when you have services that are really about the preventive side, where they're preventing costs from accruing to another set of providers. So in this case, when we think about this with behavioral health integration, it's similar with dental, where increases in utilization on the dental side would have longer term effects on the physical health side. And so one of the things we're trying to look at in the waiver is how do we make sure that those financial incentives are aligned where the party that's potentially benefiting from decreased hospitalization or inpatient utilization, which would result from any increase in preventive services, including dental, is able to share that and is required to share that with the providers providing those dental services. And so that is one of the things we're trying to look at with our whole person care approach, is how do we align all the types of providers together so that everyone's sharing and benefiting from the potential benefits of increased preventive services, and that there's a shared risk involved as well for making sure that everyone is on the hook for increasing quality of health and quality of life for our members.
Great. Thank you very much. We're going to ask, I have a question for you. With respect to the limited number of dentists providing services, are you tracking the wait time that those individual children are enrolled in the program, and how long will it be before you receive them? So as you're pondering on that question, I would ask the audience that if you have any public comments, to please line up on the left side. We're going to limit public comment to 1 minute apiece. And then when I believe that the last person's in line, that will be the cutoff from there. So if you have a comment, please do line up at this time. And then we will determine the last person, and then we'll cut it off. We're going to limit your comments to 1 minute each. So if If you can please answer that question.
Sure. So that's a great question. We do not have a handle on that data at this point in time. I think that's something that we have talked to Delta about. But again, this back to it's easier to measure timely access and wait times in a managed care environment because the plan is actually, involved in its network and managing its network on a far more regular basis, where in fee-for-service we have fairly imperfect ways of measuring that. So I think it's something that we're interested in trying to see if we can do a better job on, but we do not have quite the tools on the fee-for-service side that we have on the managed care side yet. But if we could figure out a proxy for that, we would certainly be willing to put that into some of our dashboard metrics that we're developing.
I'm disappointed in that response because I think that with this department can certainly mandate, one, getting an accurate data as relates to response time, because children are waiting for services and they're enrolled and they qualify for these services, but yet and still, they're waiting an exorbitant amount of time to receive these kind of services. Again, patient care is, at risk as it relates to the lack thereof. And so I look forward to, one, monitoring this, and I'm sure my colleagues feel the same way. So thank you very much for your
thank
testimony.
You very much.
We appreciate it. Let me see. I think the lady at the green, just wave your hand. At the back, you're in the line? Okay. She will be the last one for public comment, and we'll cut it off from there. You're up with 1 moment. Thank you very much.
Thank you. My name is Conrado Garza. I'm the Executive Director of the Center for Oral Health. We, for the last 30 years, have been working on improving access to dental care for children and other vulnerable populations in California. There is the opportunity to engage the community and to engage over 60 organizations that are part of the Oral Health Access Council to identify what are the true opportunities to improve the system. Trying to plug all the holes in the boat at once is going to have disastrous consequences. This is an opportunity to stop, think, reflect, and come up with a comprehensive plan to address the dental health care needs of Californians. There are many issues, one of which is the centralization of Denti-Cal, which is creating an ivory tower approach to resolving the issues in California. We need to decentralize that system and look at existing infrastructure such as LA Care, Inland Empire Health Plan, and try to come up with real solutions for those communities.
Thank you very much for your testimony.
Good afternoon. My name is Dr. Lilia Larin. I'm a dentist in National Cities just south of San Diego. I'm the past president of the Hispanic Dental Association National and the American Association of Women Dentists. I've been a Denti-Cal provider my entire career since 1989. In recent years, I have seen it become more and more difficult for Denti-Cal patients to receive the dental care they need, largely because fewer and fewer dentists remain in the program or are limiting the amount of patients they see. This has had proportionate impact on the California Latino community, which makes up over half of the Denti-Cal population. Until 2009, I had 2 offices where I saw 80% patients in the Denti-Cal program. I had to close one of my offices because of the reduction in rates. The percentage of Denti-Cal patients I am able to accommodate now is only 40%. There's no way I would be able to open another dental office in the future under these circumstances.
10 seconds.
Okay. With better reimbursement rates, I would be able to dedicate more time to educating Denti-Cal patients about nutrition and dental disease. I would be able to schedule more patients in my practice, and right now we have a problem referring patients to for extensive and comprehensive care because I cannot find a provider. So thank you for your service.
Thank you very much.
Good afternoon. I'm Dr. Paul Ricciardo, a pediatric dentist practicing in Orange County, and I'm speaking on behalf of the California Society of Pediatric Dentistry, the professional organization of California's nearly 700 pediatric dental specialists. I've been a Denti-Cal provider in my office for over 40 uninterrupted years, and today I have great concerns about the long wait times for appointments and a lack of children's specialists participating in the program. For infants and children, dental disease, dental decay, can progress incredibly quickly and into serious and painful conditions, and long wait times for care are inconsistent with good care. I also serve on the teaching faculty at the pediatric dental residents at USC and Chalk Children's Hospital in Orange. These fine young doctors who are completing their specialty training tell me overwhelmingly that Denti-Cal will play no part in their professional careers because of inadequate and unsustainable reimbursement rates. So we not only have an access crisis now, but looking down the road, we're failing to engage our next generation of providers.
Thank you very much.
Mr. Chair and members, Rick Rollins on behalf of the Association of Regional Center Agencies. The regional centers, as you know, provide services to people with developmental disabilities here in California, 280,000 strong families and consumers that we serve. The dental crisis in our system is real. Our folks, both medically fragile and behaviorally challenged, pose a particular hardship on providing services to this population. We strongly urge your committee and the members to please support rate increases and also access issues to this special population. Thank you.
Thank you very much.
Good afternoon. My name is Eileen Espejo from Children Now. Given the audit findings, we were disappointed that the governor's proposed budget did not include restoration to the California Children's Dental Disease Prevention Program. This is a program that still exists in statute, and it's something that's been missing since 2009. Restoring this program would allow counties to provide services to children in schools where they are, where we've heard several witnesses say that school-based health services are a critical avenue to reaching children where they need dental services. It would also allow better tracking of dental services provided to students, as well as help the state monitor dental provider enrollment and participation in Denti-Cal, thereby helping to address several of the findings in the audit report. These are counties where they know what's happening in their communities, and they're able to partner and are willing to partner with Denti-Cal so that we can make those systemic changes. Thank you.
Thank you.
Good afternoon, Mr. Chair and members. Bob Giovatti with the State Council on Developmental Disabilities. Just would like to attach ourselves to many of the comments made here already. The bottom line is oftentimes these types of hearings take place with the best of intentions, but no results come out of them. We hope that's going to be different this time. We have a lot of medically fragile and folks with behavioral issues that really need access to these services, and I think the committee has effectively outlined the problem. Thank you very much.
Thank you.
My name is Dr. Rodney Bughow, and I practice here in Sacramento. I've been a Denti-Cal provider for over 25 years, and I specialize in providing dental care in a hospital setting for those who are developmentally disabled, many of the regional center clients that gentleman just mentioned. These patients have terrible time trying to get care in a regular office. It's pretty much impossible for them. At the end of last year, the hospital that I worked at cut back on the amount of time that I could go to them because of lack of reimbursement rates. So the lack of reimbursements not only affect dental providers themselves, but it also affects hospitals, anesthesiologists, and the like. In the past, we were able to treat over 100 patients a month, and now we're cut down to half.
10 seconds.
Which means I have to come to the point where I have to tell a parent that I can't help their loved one and I don't have an option for them.
Thank you very much.
Linda Way with Western Center on Law and Poverty. We'd like to align our statement with many of the comments already made. We'd also like to highlight the need for data for adult dental access, especially in light of the legislature's leadership in partially restoring adult dental services.
Thank you.
Sarah Benjamin from Children Now. We'd like to suggest that the Medi-Cal Children's Health Advisory Panel be used to help address and track the 24 recommendations from the audit, and also to look at how to make Denti-Cal as a whole more effective. We would also like to support in the governor's January budget the proposal to make the Child Health and Disability Prevention Program referral age changed from age 3 to age 1. Thank you very much.
Thank you very much.
Sonia Benjamin with the State Council on Developmental Disabilities in the Sacramento area. Dental care is vital for children and adults with developmental disabilities. Many of these individuals have either behavioral or physical conditions that cause them to require anesthesia or dentistry for any dental care to be provided. There's a severe lack of access to this service in Northern California especially. It is also inappropriate and sometimes harmful for individuals to have to go through the protocol steps that are required for approval for funding. I'd like to submit a collection of 51 stories about individuals who require anesthesia dentistry. I urge you to assist to find means to increase the availability of this vital service. And we only have 6 copies, but we will email additional.
Thank you very much.
Hi, my name is Donnell Kenworthy. I'm here representing my son, DJ Kenworthy, and we're one of the families that's involved. Our story is with Sonia, and my son receives anesthesia type of dental care. He has since he was 2 years old, and we continually have it. It's a very difficult process to go through and to be told, I'm sorry, you can't be given care when your child is hurting. DJ is both medically fragile and has behavioral issues, and it makes it very difficult to be told that your hospital is closing their doors because they don't have enough funding to keep them open for children like mine, and for providers not to be able to give what they know they can give, but they cannot because bottom line comes down and there's not enough funding. So please make a change.
DJ, we're going to be fighting for you and fighting for all the children. Thank you very much for your testimony. You're welcome. I'm going to reserve my comments for Senator Hernandez. If you want to have any final comments, and no, okay. Chairman Bonta, you're good. I want to thank both committees, Senator Bonta and also I called you Senator, I'm sorry. Assemblymember Bonta and also Senator Hernandez, and that makes up both committees as well as the JLAC committee for, again, your input, your articulation of the points that was raised here today. I think, again, it's very important that we continue to shine the spotlight not only on this department but other agencies that just by the sheer fact of receiving taxpayers' dollars of this state, that we hold everyone accountable to what they said they need to be doing in terms of providing services to the residents of this state of California. Our children's health is at risk. We need to make sure that we do everything that we can to provide that kind of leadership, even speaking truth to power. To the stakeholders, to the auditor, thank you very much. Madam Auditor, I have one question for you in terms of next steps. This is an oversight committee that has the audit has already went forward. This is an oversight committee regarding the budget that was the audit that was done. Excuse me. Let's talk about next steps and what will be the follow-up from your department and the expectation of the department coming back to you with information.
Certainly, Mr. Chair. Thank you. As we indicated in our testimony, Mr. Carlson and I, we have received a 60-day response from the agency. As you know, the report was issued in December of 2014. The 6-month response would be due in June. We would expect that from the agency, but I think we need to have a conversation with the Department of Health Care Services. Since many of the recommendations are planned to be implemented by July, I think it would be more beneficial for my office to receive a response from them in July so that we can share with the legislature specifically where the department is at, particularly with respect to those 15 recommendations that are supposed to be implemented by July of 2015, and then we can give an update on the remaining recommendations, and then certainly we'll be expecting the one-year response by December of this year. So that would be the follow-up, Mr. Chair.
Thank you very much. We look forward to that report coming to all 3 committees. I was just asking Debbie a few moments ago, what happens when a department violates the law?
Well, I don't know what Debbie's answer was. Well, Mr. Chairman, certainly I don't know what the ramifications are either as far as the administration. I mean, that's ultimately up to the administration's decision as to whether or not there's any adverse action taken within the department. Certainly any mandate that any state agency or any entity, certainly my office, we take what the legislature makes a determination we're responsible for doing very seriously and try to get that work done. So with respect to any ramifications, as far as Mr. Carlson indicating we didn't see anything in state law that talked about penalties, but again, there needs to be department officials, with all due respect, held accountable for implementing programs they're responsible for, myself included.
Sure, I can appreciate that response. I just think that the legislature give directives through bills, and departments can't just ignore those directives. We should hold people accountable, and there should be ramifications for breaking the laws in which we set forth, again, that the governor signed. And so we call those individuals tasked. Certainly it's going to be my desire to do that as a JLAC chair. As long as I'm in this particular position, I'm going to make sure of that, and we should be exploring. So maybe we should have a conversation with Ledge Council to see exactly what needs to be done. I want to say thank you very much for participating in this hearing and all the comments and things of that nature, and we stand adjourned. Thank you very much.